solemnly remembering Shahid President Ziaur Rahman and Mother of Democracy, former Prime Minister Khaleda Zia. It is a great pleasure to welcome you to this important consultation on health entrepreneurship in Bangladesh. This conversation comes at a timely and hopeful moment for our country, when the present government has come after a huge mandate under the leadership of Honorable Prime Minister Mr. Tariq Rahman. We believe health is not a privilege, it is a fundamental human right. Bangladesh's health sector has been facing years of neglect, lack of accountability. The people of Bangladesh pay 72% of health expenses, making illness one of the leading causes of poverty. We endeavor health for all, ensure universal health coverage, and deliver health care to every citizen with dignity and respect, so that no one is ruined paying medical bills and quality care reaches everyone's doorstep. Bangladesh has always been a nation of resilience, creativity, and practical problem solving. We have faced poverty, disasters, disease, displacement, and oppression. Yet again and again, our people have responded with courage and resilience. Our health story reflects this national strength. We aim for disease prevention and health awareness, to deliver services door to door in villages. Trained health workers will initially focus on identifying diarrhea, high blood pressure, diabetes, malnutrition, and other problems, strengthening prevention and awareness, and prioritizing care for women, children, and elderly. Today, we face a new generation of health challenges. Non-communicable diseases are rising. Our population is aging. Climate change is creating new risks. And urbanization is changing the way people live, work, and seek care. These challenges are complex, and they cannot be solved by one institution or one sector alone. They require new ways of thinking, new partnerships.
Democratization of economy, we actually also include health sector, because it is the right of every citizen to get the health care in support of the government, basically. So we are primarily going into primary healthcare system, preventive healthcare system, mobilizing about 100,000 health workers to advise the rural Bangladesh people to how to take care of their health, And private sector and government are already, we have taken decision that how they can work together. The patient instead of building too many government facilities, how do we bring in the private sector into supporting the healthcare load that government cannot take on its own, but the space is available in the private sector. And they have got the space. How do we share this space? This is another area that we are working on, and policy decisions have been made on this. And when you have the private sector and the government sector competition, that is also important. The performance that comes from the private sector always influences the government sector. And historically, private sector performs better because the management, the drive, and the interest is much more in their own business. The government sector always falls behind. This is another reason why we are trying to integrate the private sector in the government programs.